Hey folks, can you hear me okay? Rachel, nice to see you again. Good to have you here. Hey, a couple familiar faces. Mark, I think you're familiar too, but I can't place where we might have seen each other before. Good to have you. Welcome folks. You are welcome to keep your videos off if you prefer. You're doing something in the background. If it works for you, I would like to invite you to have your video on, partly because it really helps me as a presenter to feel like I'm talking to a group of actual humans and not just a room of blank screens. That being said, it is totally up to you, but very glad to have everyone here tonight. This is a good turnout. I was excited to see folks all register, and that's affirming for me as we get going with this new webinar series in the new year. This is fun. This is a little bit different take on, we've been doing guest speaking lectures before, and then I've basically taken a year off of doing anything extra like the guest speaking lectures because this is my third maternity leave in 4 years. So as you can imagine, I've been on other adventures, which has been wonderful. But yeah, this is a new experience for us. So I'm going to go ahead and get started in the interest of time. We've got lots that I could cover, and I would like to have some time at the end for questions as well. So that being said, the first thing I'm going to do for you is I'm going to drop for you in the chat a couple of pages that you can follow along on if that's of interest to you. So the first thing I've dropped in the chat for you is what we call our field notes page. So if you can access that, if your chat comes up somewhere on your screen, or maybe it's at the bottom of your screen, you'll see a little chat box. The field notes page is something that we use throughout our courses with Mental Health Wilderness First Aid. And so that gives you an outline and a structure of the course, and that'll help you get oriented to what it is that we do in the program. So there's one handout for you. The second handout I'm going to offer you is a field support plan, and this is something that I'll go over briefly towards the end of the class. This is what our programs most of them center around, is the ability to distill everything that we talk about in the course into something that we call a field support plan for supporting someone who may or may not be having a hard time in the field. I've had guides make one for themselves if they're going into the field and they feel like, hey, I have a trauma trigger or I have anxiety or whatever. That's been quite successful. I'll tell you towards the end of class, I'll tell you my personal experience with having a personal field support plan when I didn't think that I would need it, and it turned out to be significantly more helpful than I thought it would be. So those are two handouts for you as we get going here, right in the chat. So I will introduce myself a little more thoroughly, and you should have gotten the notification as well that I am recording this session. That is so that I can post it on our social medias and all that good stuff. If you have any concerns about that, or objection to your audio and video being displayed in some way, if it might pop up on YouTube or something like that, please just let me know, and I will work with you to make sure that that's respected. So let me introduce myself a little more thoroughly though. So my name is Daye Hagel. I am the director and the founder of Mental Health Wilderness First Aid, which is what we're going to be chatting about tonight. And a little more about me. So I've been a wilderness guide since about 2004. Long time now. Like I said, the last couple of years have been a little different as my life shifts into having a young family, which I highly recommend. Could not be more joyful about this period of time in my life. And at the same time, I'm not overnight guiding anymore, but I used to do lots and lots of this stuff, average something like 120 field days a year most years. And then I also became the executive director of the CCAT Guides Alliance of British Columbia, which is our provincial certifying body out here on the West Coast. I also did my ground search and rescue training at one point. I have a master's degree in anthropology and a master's in counseling psychology. So the master's in counseling psychology came out of me having worked as a guide in the field for something like 15 years at the time. And I remember one summer in particular, we ran into a couple of things in the field where we did some evacuations from the field for participants for non-medical reasons. And I started thinking, I don't know if I handled that very well. I remember someone actually said to me at one point that summer, they were like, Daye, don't be too hard on yourself. You're not a counselor. And I was like, I'll show you I'm I'm going to be a counselor. So I ended up going back to school and becoming a counseling psychologist. So at this point in time, I am a Canadian certified counselor with the Canadian Counseling and Psychotherapy Association. I worked for a long time actually with First Nations, and I'm going to show you where I am because not all of you are from my neck of the woods. But so this is the US-Canada border, and this is the big Pacific Ocean, and some of you will be familiar with there's Vancouver and there's Seattle. There's a little collection of islands right here that actually spans the border. On the US side, it's called the San Juans, and on the Canadian side, it's called the Gulf Islands. So I grew up on a little island called Salt Spring, and that's where I'm calling in from tonight. And I grew up kayaking throughout these waters. These are traditional Coast Salish waters here, and then I started paddling more and more up in bigger waters, more remote areas, that kind of thing, and all down the west coast is where I ended up paddling. Now, as a clinical counselor, I actually have a specializations, or most of my experience as a clinical counselor has been working clinically with different First Nations. And so some of what I did was with the provincial government through Aboriginal child and youth mental health down here in Coast Salish territory. And then I actually ended up working most of my time as a counselor was working with the New Channel Tribal Council, which was all of the nations out here along the west coast of the island. A lot of the areas where I had paddled in these big open waters, very remote areas, that kind of thing. And there's a collection of communities along the coast, and they've been here for thousands of years. And there still are communities along the coast here. And as you can imagine, for those of you who might be familiar with the West Coast, this is quite a physically, physiologically, geographically, quite a rugged area. So a lot of these communities here are still to this day, they're boat-in access only or fly-in access only. And so as a clinical counselor, I ended up returning to a lot of those same areas, but we would take time to get out to the West Coast, right? It would often take, 5 hours to get from Courtenay, maybe where I was living at the time, on gravel roads and water taxis and that kind of thing, and get out to some of these West Coast communities and then hang out there for several days. And one thing I really appreciated about working with that organization in particular is they were very, very culturally focused. And so they did this quite intentionally, right? They brought me in as a Western trained clinical counselor with my gifts and my background in trauma education and that kind of thing. And then they would always pair me up with someone who had some traditional teachings or cultural experience. So I'd go in with our cultural support workers, our Kwasa team, I'd go in with an elder, something like that, right? And we'd always go into community together and figure out, what we could do to offer support to folks who are having a hard time. So I loved working with that organization. And at the same time, this was much more remote area work, right? And so it gave me quite a unique experience on what is it like to be out in remote areas where even if there is a little community here, there's a little community here behind me. This is me on a clinical day, right? I'm pushing all my stuff up on this wheelbarrow and I'm gonna go up into community and hang out for a week and then come back home at the end of the week. And at the same time, okay, yes, there's a community there. There actually was a clinical nurse on staff and that kind of thing. And if we decided that we needed to evacuate somebody, whether for a medical reason or for a mental health reason, right? It was quite a ordeal to evacuate someone just physically where we were, right? Nearest hospitals are in Port McNeill or Campbell River, and on a good day when you're not too concerned about weather, it'll probably take 4 to 6 hours to arrange an evac, and that would be a good day, right? And if it's not a good day, we might be weighing risks of things like, okay, well, can I support this person here in community, or can I support this person out here on this hiking trail or on this kayak trip? Or do I really need to kind of push my weather here, or do I really need to get everyone out of their tents in the middle of the night because we're going to help evacuate this person down the trail we just walked up, or whatever. So that's a bit about my employment background and my clinical background. And this program, Mental Health Wellness First Aid, grew out of my background clinically and professionally in both those senses, right? So the problems that we identified were that there were lots of great first aid programs out there. And at that point in my guiding career, I'd taken, 2 or 3 week level of first aid training, at the time 80 to 120 hours. And those were great programs, right? Highly grateful for the amount of training that they offered me. Things like someone has a head injury, someone has a broken bone, someone has an open wound, someone has a mysterious stomach ache. You're not sure quite what to do with that, right? Okay, how do you assess that in the field? When do you evacuate, etc.? So I was very grateful for that. And at the same time, I started reflecting on, okay, and like how many medical evacuations have I done in my career? And it wasn't nothing. It was maybe over 15 years or so at the time. I had done 6 or 7 kind of urgent medical evacuations from the field. And I was very grateful for the medical first aid training. And I was also reflecting, okay, but what is it that I do every week, right? So every week I support somebody with blister care, I support somebody with exposure to the elements or sunburn or dehydration, that kind of thing. And every week I probably support somebody with anxiety. Every week I support someone who's having a hard time for some reason. Maybe they have some trauma in their past and it happens to have come up on trip. Maybe there's some recent grief in their life. How do I respond when they tell me that their cat died, right? How do I respond if somebody tells me that they might be wanting to end their life? And I was like, I don't have the skills to deal with that. And these first aid programs don't tend to cover those things. Now, the kind of other good news about this is that over the years, over the last, decade or so, there actually have been more mental health first aid programs that have started up or that have started training. I know the Red Cross runs a psychological first aid program now. The Mental Health Commission of Canada runs a good program that I've taken a couple of times. There's other ones in other countries. Has anyone taken another mental health first aid program of any kind? Oh, not in this group. Okay, interesting. Once in a while someone has. Okay, my other observation though, as a student of those programs, because I took some of those programs myself, was that those programs tended to assume that you were where? They tended to assume that you were in an urban center, right? And fair enough, most people who take those courses are. But they would say things like, okay, if someone's having a hard time, here's some empathy skills, here's some communication skills, those are great skills. Basically talk nice to this person and help connect them to resources, get them to a hospital, get them to an evacuation, call a psychiatrist, that kind of thing. Now, if we're out in a remote area for all of those reasons that we just talked about, it's like, okay, do I really need to evacuate urgently to a hospital every time somebody has what looks to me like a panic attack, even though it has some cardiac symptoms? What if that is consistent with their history? What if they have some ways of managing that? What if it happens to resolve when we do a certain mindfulness activity that's worked in the past? Does this person may or may not have medication, right? When am I weighing the risk of the urgent evacuation, which of course will increase the risk profile, not just to the person, but to the whole team, versus the risk of keeping that person in the field? And so that's where this program comes in, is this program is mental health first aid skills for folks who are having a hard time in backcountry areas, right? And the backcountry areas piece is key because this is where the wilderness first aid kind of more lens, intake procedures, assessment criteria, and also say we are going to do an urgent evacuation, because sometimes you will do urgent evacuations for mental health reasons. And even an urgent evacuation might take 4 to 6 hours. So what are you doing in those 4 to 6 hours, right? Maybe we want a little bit more of a toolkit of what we can be aware of, how we can support the person, and also what we can be aware of with the group dynamic as well. So that's where this program came from. And I like to offer folks a reminder because actually I'll skip to the next slide for a moment. I'll go back to that one. We get all kinds of fun folks coming into this program. I really do love it. Most of what we do actually is run the program online. And that's a real advantage because we can have folks from across the continent, and we often do. We have folks from Europe, Australia, Thailand recently, all kinds of great folks. Lots of tree planters, search and rescue, First Nations, outdoor educators, remote area oil rig folks, all kinds of folks come through. So this has been fantastic. And I also, to go back to this slide, I like to remind folks that you don't have to be a therapist to offer mental health first aid. And I think this is where we sometimes trip over ourselves a little bit, because we want to be concerned, and I think we should be concerned about being aware of what our boundaries are. I think we should be concerned about when we do need to help somebody connect to other resources, and we always talk about resources when we support folks. But I also think if somebody came to you in the field and said, hey, I cut my hand, can you help me? and your response were, whoa, I'm not a doctor, I don't want to do the wrong thing, I don't want to make this worse, I think you should just go see a doctor about that, right? Maybe you're right that the person should go see a doctor, but also what a missed opportunity, because are there not any number of things you could do to support on the way to going to see the doctor that are totally reasonable and appropriate to do in a first aid capacity or in a non-therapist capacity? Are there not any number of things you could do to support the person? So I like to offer that as a reminder as well, right? This course is mental health, first aid skills. We're not training people to be therapists. We're training folks who are going out into remote areas, and just like you might encounter a broken bone in a remote area and you're not a doctor, you might encounter someone with mental health challenges in a remote area and you're not a therapist, and you can still do lots of great things. Now, I pay attention to things when I'm looking at live classes, and I pay attention to when people unmute, because sometimes it means that you might have a question. Mark, I've noticed that you're unmuted. Did you want to ask a question?
Yeah, I didn't answer your earlier question. I'm from Salt Spring Island.
Oh, no way.
I'm with the search and rescue, but I'm also I work with the BC CISM team.
Yep.
Yeah, so and that's kind of my experience. And we're trying to put together in our search team uh, some mental health, getting together a group of the members and talking about mental health and how we can better help some of the subjects that we are, need not just medical attention, but rather mental health protection. So that's where we're at here. And do you still live on Salt Spring Island?
Yes, yeah, Mark, I was just saying earlier, I'm calling in from Salt Spring right now, and
Yeah.
that's interesting. So Salt Spring SAR team was the one that I volunteered with briefly about 10 years ago. And for folks who don't know what Mark's talking about, so CISM means critical incident stress management, or sometimes it's called critical incident stress debriefing. And essentially, if there's a critical incident, maybe a near miss or maybe a fatality or something like that in the field, then critical incident stress management and debriefing is something that can help support folks in the aftermath of that. Now,
I was
oh,
thinking
sorry.
also that we just sat together last Tuesday, and we have to figure out how we're going to do this, and you could be a big part of that.
I've been talking actually to what's your psychologist name, Kate?
Kate, yeah.
Yes, I've been talking to Kate actually, so
Oh, you
that'd be
have.
great.
Okay.
Maybe we can collaborate on something.
Well, I'm
Um,
meeting with her tomorrow at 1:30.
oh, great. Well, I'm glad you're here. Okay, folks, I just dropped in the chat for you one more time because a couple new people came in. In the chat is our field notes page, and I'm going to go through that here. Now, just to wrap up what I was talking about with you, Mark, and I'll just mute you in case of background noise there. Just to wrap up what I was talking about in terms of critical incident stress management. So, two things that might be of interest to folks. One is on our YouTube channel and on our events page, actually, where you signed up for this webinar. At the closer to the bottom of that events page, we had a guest speaker come through a couple of years ago. It was Chris Miller and Greg Mushiminski, I think, or Chris Mushiminski and Greg Miller. Anyway, you'll see it. It's on critical incident stress management and debriefing, and they're the BC coordinators of the CISM program. That was a great guest speaking lecture for anyone who might be interested in that topic. And the other little piece I'll just pop in there is that we have two levels of courses that I'm going to talk about here in a moment. In our upper level of course, one of the things we talk about is response to potentially traumatic injuries or potentially traumatic events that happen in the backcountry. So not only if somebody comes into your program with some pre-existing trauma, how could you respond to that? But we also talk about if something potentially traumatic happens while you're out in the field. What are some things that you can do to help everybody potentially on your team to mitigate risk factors for post-traumatic stress and increase protective factors against post-traumatic stress? Because again, there are some fantastic things that are fairly simple that we can do in a first aid capacity to help just increase people's resilience. So that's a couple of notes for our folks here. So I'm going to go back to sharing my screen, and if you'd like to have that field notes page I just put in the chat up in front of you, you go right ahead and do that. And just so folks can set their internal biological clocks, my goal here is to wrap up at 6, partly because I have a very little family with 3 very little kids who are going to be waiting for me for supper at that time. But I am hoping to have time for questions, and I'm more than happy to chat with folks after over email or anything as well. So we have all kinds of fun folks come through this this program. Most of what we do, like I said, is online. We do custom programs as well, but we also get invited to go to different places in the field. Okay, so here's an outline of the course, and this is also an outline of how we invite folks to orient their response when someone's having a hard time. And what you'll notice, if you're familiar with medical first aid, let me just do a quick poll. We've got a few people on the screen here. Who has a medical first aid ticket of any kind? Bunch of people. Okay, great. So you might be familiar with medical first aid with the idea of a primary survey and a secondary survey. Yeah? Okay, getting some thumbs up. Fantastic. Okay. A primary survey is, what do you need to pay attention to as you're coming on scene? Right? Someone's having a hard time, or there's been some kind of accident or something. Okay. If you have a good medical first aid instructor, they'll train you in, as you're coming onto a scenario, the first thing you're going to do is take a deep breath, right? And then exhale, ground yourself in your own nervous system. That's great for medical first aid, and it happens to be the same with mental health first aid. Okay, and then they'll train you with primary survey. What do you pay attention to right as you're coming on scene, right? Give me a quick idea. What's one thing you would check as you're coming on scene for the first time with medical first aid?
Safety.
Safety, great. Little scene survey. Any danger to myself? Any fire, wire, glass, gas, thugs, bugs, drugs? That's a little rhyme some people like. Yeah. Great. So safety to self and to others, and then you might check things like what happened, level of consciousness, how many patients, do I need to get somebody to hold the head, ABCs, right? Do I do a rapid body survey? All these kinds of things are primary survey for medical first aid. Yeah? Okay, as we're coming on scene with mental health first aid, this is actually similar, but I'm going to back up for a sec. Okay, so medical first aid primary survey is all about safety and stabilization. What do I need to pay attention to right now so that things don't deteriorate in front of me medically as I get distracted? Okay, mental health first aid has a similar orientation to medical first aid. We have a primary survey and a secondary survey. The first thing I'm going to point out in this outline, though, is that we actually have kind of a pre-step, and the pre-step we call building relationship. And I'd just like to remind us that relationship, having a relationship with somebody, is the foundation of everything else that we might offer in the mental health world, right? So having a relationship with somebody right from the start is going to be an advantage to you, because you're more likely to notice when something's a bit off with this person. You're more likely to notice early, which puts you in an advantageous place to be able to offer some help, right? You're more likely to have an intuitive sense or an experiential sense of what might be helpful to the person. And if you have a relationship with somebody, they're more likely to be open to anything else that you offer in the mental health support world. So we talk about relationship in the class. We spend the, kind of a good quarter chunk of the class talking about what is mental health, what are our approaches to mental health, what are some relationship building ideas with people, what are some communication strategies that can help de-escalate or can help connect. And we go back to the idea of connection is the correction. If we ever get stuck with any of the other ideas or steps or interventions or assessments that we talk about, I like to say, okay, you're stuck. How can you connect? Connection is the correction. So that's why on our sheet, which we use throughout the course, we have build relationship as this line that kind of intersects all the other steps. Okay. Now, to go back to what we were just talking about, primary survey for mental health first aid is also safety and stabilization. Okay, and just like Mark said a moment ago, the first thing we're going to check is, hey, what's the level of actual imminent danger here? Is there any danger to myself from this person's behavior? Is this person a danger to him or herself? Is there danger to other people? Is there danger in the environment that the person's responding to? Because maybe it's not a mental health issue then, right? Maybe it's a response to the environment. So we have what we call an ABCs, and that's the A. right? The B is what we call brain, lizard, or wizard. Now that just means how escalated is the person in their threat response system. And I'm actually going to talk about that in a few minutes. And then C is for conditions or medical conditions. And the C here means, I like to say, don't get so excited about the mental health first aid course that you just took that you miss the fact that the person's actually having a medical condition. Because that's important, and it could be quite devastating if you miss that, right? We don't want to be like, oh, well, let's just do some mindfulness exercises and some deep breathing, and that'll help your stomach ache feel better, right? And we miss the fact that, hey, the person actually ate a bunch of undercooked chicken because you didn't do a very good job cooking it as a guide, right? So we want to keep ABCs in mind: safety and stabilization, just like medical first aid. And then we talk about what we call lizard brain interventions, which could be very, very simple things, but it's anything that we just do to help the person in the moment and myself in the moment to regulate our nervous systems, right? Because if we're actively anxious, or we're actively angry, or we're overwhelmed, or we're having a hard time, right? It's not the best time to jump into problem solving, offering advice, asking a lot of interrogative questions, that kind of thing, right? Those are all great tools to have in the toolkit, but it's a little too soon for them right now if the person's escalated. Okay, so that's our primary survey. Now, with medical first aid, once you've done a primary survey and you have safety and stabilization, ABCs are good, maybe you've called for backup, whatever. But now you can get into a secondary survey. And medically, this would be where you might get more curious. You might ask questions about history. You might do an expose and examine. You might decide to make a treatment plan. Am I going to go cut down a tree and make a splint for this person and do an evacuation plan or whatever, right? These are secondary survey questions, information and planning. And mental health first aid, it's the same thing. The secondary survey is once we have our ABCs taken care of, the person's regulated, I'm regulated, and now I need to figure out what to do next, right? How am I going to help support this person for the rest of the field experience that we're on, or for the rest of the season if you're a tree planter? What do we do with all this information? Now, I will say, in real life, an organic situation, you might not get to the secondary survey. Often when people are having a hard time, all they need is for, I might need Rachel to come and sit with me and say, hey, Daye, it looks like you had kind of a stressful day. Right, maybe we'll go for a little walk together, maybe we'll share a tea, maybe she'll listen to me and allow me to get some stuff out. And then at some point I might just be like, okay, Rachel, good night. Right? And that's it. Right? That was a fantastic mental health intervention because that's connection is a correction. Great. Okay, so like half of actual mental health first aid scenarios, that's what it's about. The other half might be, okay, what do we do next? How can we actually do some problem solving here? Or what more information do I need to gather? Am I going to do some paperwork, etc.? And that's where the secondary survey really shines. So in the course, we talk about what more questions might you want to ask? What information do you want to gather to help you figure out how to support this person in the long term? How might you ask sensitive questions, right? Like, has this happened before? What's the history of this? So we talk about a secondary interview. And then we have this little question that I call stages of change. Stages of change, which some of you might have encountered before, but it's a way of thinking about where people are at relative to, does this person want my help? Not everybody wants our help, and not everybody who's having a hard time wants the kind of help that we think would be helpful for them. And so it can be helpful to us as first aiders so we don't get frustrated to have an idea or a little model of thinking about when people might not want our help, or maybe part of them wants our help and they're not fully ready to act on it, etc. What are some options? So we talk about stages of change. Now, when we have a relationship built with somebody and we have some regulation and we have a bigger picture of what's been going on for them and how we might support them, and we have a sense that, hey, this person wants our help, great. This is a really nice time to pull out what we call the rational interventions or the wizard brain interventions. And here's all kinds of like problem solving type things that we can do. And so we train ourselves in the course in rational interventions as well. Connecting, oh, am I clicking through my pictures here appropriately? There's our stabilization photo. There's our paperwork photo. Yeah. And then last but not least, we always talk about resources, offering people resources and or connecting to resources yourself, because we're offering first aid, right? We're not trained therapists in this role. We're offering first aid, and that implies that there might be more to come. And so we talk about all kinds of different ideas for resources and how urgently you may or may not be evacuating a person. When can you stay in the field? That kind of thing. So that's an overview to our program. And just to orient you further to the programs we offer, we have 2 levels of certification. So our first level is what we call the basic course. It's 16 hours. And what we do in the basic course is we go all the way through these different steps. We talk about assessments, interventions, relationship, communication, all that kind of stuff. Most of the examples that we're using and the scenarios we're using in that course are around things like anxiety, stress. We talk briefly about an introduction to trauma and PTSD. It's fairly brief. And we do talk about panic attack usually in that class. For those who are interested, there's also a second level of certification, and that is you get a 40-hour cert. The good news about the 40-hour cert is it includes the 16 hours that you've already done. So once you've done the 16 hours, you sign up for something called an upgrade from basic to 40-hour cert, and you just do those additional 24 hours to get a full 40-hour. In the 40-hour upgrade, what we do is it's the same structure, the same outline, basically the same interventions, a lot of the same things. But in the upgrade to 40-hour course, we get into what you might think of as the bigger mental health issues. So we look particularly at scenarios around things like depression and mood disorders. We look at grief and loss. We get a lot more in depth into trauma, PTSD, post-traumatic stress prevention, like I mentioned earlier, psychosis, psychotic disorders, disordered eating, self-harming behavior, what to do if somebody tells you that they might be thinking about ending their life, the bigger mental health issues. And what I really love about that course is we spend the first chunk of the course talking not necessarily about just looking at people through a lens of their illness, but looking at people through a lens of resilience. Because even when people are struggling with all kinds of big mental health issues, they're surviving those issues, right? Like they're there in front of you. And so we want to have a double lens on when people are having a hard time. We run that course about twice a year, and the next one's coming up in March. So we got 2 more basic courses. We had a February and a March basic course, and then we have an intermediate course come up in March as well. So that's kind of an overview of the whole program. Now let's see what else we can get to today, so I can give you, my goal is to orient you to the program, but also give you a little bit of ideas that you can use right away in the field. So I want to introduce you to a concept called the wise mind. I want to talk a little bit about the neurology of stress, how that works in the body. We'll get a lot more into it in the class. And then finally, I want to leave you with a resource, which is what we call our field support plan. And a field support plan is just writing down what are we going to do next. Enormously practically helpful in the field to have just a brief written document. So that's my goal. Let me just pause for one moment and see if there's any questions. Feel free to use the chat or to speak out. I will pause for 10 seconds or so if there's any questions.
Daye, I have a question. It's Vanessa.
Hey? Yeah.
I was looking at your courses and the ones in February as well as March, the weekend courses. If we can't attend one of the days in February, can we do the second day in March?
Yeah, that's a great question. Yes, basically. So we do require live attendance in order to get a certification. And we like to encourage folks to go through it with the same cohort because then you get to know people, etc. That being said, it's not uncommon that we're, my mom, blah, 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 and I needed to whatever. Or sometimes people know ahead of time that, hey, I can't do this. Could I mix 2 cohorts? So it's not ideal, and we certainly support it regularly. Usually there's a nominal admin fee, which we are willing to waive if there's some kind of medical reason or something like that. But yes, in general. The only thing I would say is that it is good to do the course units in order. So for instance, if you couldn't make like classes 1 and 2 of the February course, then I'd invite you to do classes 1 and 2 of the March course and then finish it either with the March course or with the April course, if that makes sense. Like we try not to do them out of order because they're in order for a reason. But yeah, we can work with odd situations if we have to.
Okay, thank you.
Anything else? Going once, going twice? Okay, I am talking fast. That's partly because I'm excited and I really love the program, and I'm excited to have you all here. And it's also because I do want to get through some stuff that you can apply right away in the field, even if this is the only time I ever see you. So let's look at a couple of things that might help orient us to when someone's having a hard time. Wise mind concept first. The idea of the wise mind is a little bit related to just the idea of approaching the idea of stress. Like, what is stress, right? Often when we say stress, even when I say stress in this course, what I actually mean is distress or bad stress, right? Stress is not bad. Stress is not inherently bad. What stress means is that there's a demand on our system in some way, right? And it's beneficial to have some kind of demand on my system, physiologically, psychologically, right? It's detrimental to have no stress, and it's detrimental, obviously, to have too much stress. Does anybody know what is the word for good stress? There's a word for good stress. Jake knows it. Where's the unmute button?
Jake knows the word, but he doesn't know how to unmute himself. I think it's like e-stress?
Yeah, great. And actually, I don't know fully how to pronounce it either, Jake, but eustress, something like euphoria, something positive, right? And we actually want to encourage people to put themselves into stressful situations. And if you're in any kind of really outdoor kind of profession, you probably are actively trying to encourage people to step out of their comfort zone, right? The idea of the comfort zone circle shows up over and over again in outdoor education, but it'll also show up in other things where you have to train. Search and rescue is an experience where you undergo training because it trains your nervous system for how to respond when it is under stress. And so you're trying to do that in a training scenario so that when an actual critical incident occurs, your nervous system is prepared for it and it can perform, right? And so we actually do want people to encounter stress, and we can get into trouble when we overprotect people. Now, this is where the wise mind concept comes in. So the wise mind concept is one of the concepts the course is kind of modeled around, and it's from dialectical behavior therapy. Not that that's super important, but what the wise mind concept says is that there's basically two parts of our mind, right? We have an emotional mind and a rational mind. And that's very simplified, but it actually does reflect how different parts of our brain work together, which I'll get to in a moment. And it's possible to make errors if we are too unbalanced in either direction. Okay, so kind of the classical error that we might be concerned about when we're concerned about mental health is, gosh, we don't want to be overly rational and ignore people's emotions, right? We don't want to dismiss emotions. An example of being too rationally minded might be like, I don't know, Spock from Star Trek. You folks familiar with Spock, right? So we're just focused on, well, okay, what's the logical thing to do? It doesn't actually matter how I feel. I'm not going to pay attention to that. Just like, hey, this is what we're doing. Okay, that can result in challenges for mental health, and obviously it can result in rifts in relationship, and that's not good. It's also possible to be unbalanced in the direction of the emotional mind, and for that to cause problems. And what that could look like is, okay, I feel anxious and I am paying so much attention to my anxiety. All I want to talk about is my anxiety. My anxiety is spiraling out of control. I know rationally that my anxiety is out of proportion to the situation I'm actually in, but I'm going to just let it spiral out of control because I'm going to avoid anything that challenges me with that anxiety, right? That can also cause problems. So we cause problems when we underprotect people, and we also cause problems when we overprotect people. And I think this is my one little kind of side just note. It's almost, well, it's partly a critique. I think as a society in general in the last few decades, we've gotten more and more mental health aware. And we're having more discussions about mental health in the workplace and how to support people in trauma-informed perspectives and all that kind of thing. And I think for the most part, that's really good, and it has been good for people. My one critique or my one concern would be that it's possible for us unintentionally to swing a little too much in the direction of overprotecting people. And that can also cause problems in the medium to long term, and it's something we talk about in the course when we talk about the wizard brain interventions or the rational interventions. So what the wise mind concept says is that where we want to be is in this integration or the synthesis where we're aware of our emotions, we allow ourselves to feel our emotions, we allow ourselves to communicate about them, we're empathetic when somebody tells us about an emotional struggle that they're having, even if it is out of proportion to the reality that they're in. And at the same time, we bring in the rational mind and we think about, especially, okay, once we're regulated a little bit more, we think about, okay, what do we want to do with this feeling, right? And that's a conscious, rational decision where we're figuring out, is this in proportion? Is this true? What else is true? What else is helpful? What else can I do with this consciously? And that's where we want to be, is in the wise mind. So this is going to relate now to what we're talking about with the neurology of stress. Now, I just talked about stress as it could be eustress or it could be distress, but as our nervous system experiences stress, how does it respond? Okay. Let me just get my timing right. I'm going to spend about 10 minutes on neurology, and then we're going to talk briefly about field support plans, which is something you can take home with you, and then we'll see if there's time for a couple questions before we wrap, okay? Let's talk about the neurology of stress response. We go into this in quite a lot of detail in the course. I spend around an hour and a half talking about this, and then even more time in the upgrade course, because we talk specifically about how our nervous system responds to normative stress and to normative regulation. And then we also talk about how does the nervous system respond when we're experiencing not just something stressful or overwhelming, but actually potentially traumatic. And the brain does some fantastic things to help us when we're going through something potentially traumatic. So we talk a lot more about this in class, but here's my little tidbit of introduction, okay? 2 principles for neurology of stress response. Principle 1 is that my brain is my friend. My brain is my good friend, and it's always trying to help me in whatever situation that I'm in. And I like to come back to this principle as a touch point over and over again, because it's really easy for me to look at something like, if I have some trauma in my background, right? I might be like hyper-vigilant, I might have trouble sleeping, I might get really snappy and irritable with people, right? So there's all kinds of symptoms that I might have. And I might think, oh, why am I doing this? Why am I like this? This is so hard on me. This is hard on my relationships, right? I might have shame about this. And I might think, can't I change this? Can't I change how my brain is responding, right? Now, it might be true that the way my brain is encouraging me to respond might be out of proportion to the actual level of safety that I'm in now. It might be true that the way my brain's encouraging me to respond is not actually helpful to me. It's causing problems to me. And it might be true that I want to retrain my brain to have a different response and a different level of vigilance. Those things can all be true. And I always like to go back to principle 1. Can I see how my brain is trying to protect me because of how it's learned that it's had to protect me? Right? And I always like to start from that place of empathy with my brain, partly because it's a resilience-based perspective, and partly because it can help people reduce the shame that might come with those things, right? So principle 1 is my brain is my friend. And principle 2 is about the order of brain development, okay? And here's how I like to say it. This is based on the work of Dr. Bruce Perry, okay? The brain forms from the bottom up and the inside out. So those back, bottom, inside parts of the brain, they develop first, both in my own human lifespan. Those are the first parts of the brain to develop when I'm not even born yet. And those are the first parts of the brain that are thought to develop from the evolutionary perspective, right? Millions and millions of years old, these back, bottom, inside parts of the brain. And then the farther out and fronter that we go in the brain, those are the newest parts of the brain, right? And when we get to like the very front of our brain here, this is the outermost, frontermost parts of the brain, and this is the last part to develop, both in my own human lifespan and also from an evolutionary perspective. This is a very new part of the brain. So that's principle 2, okay? Now let's see how this breaks down. I'm gonna break this down and make this pretty simple. Pretty simply, there's 2 parts of the brain, okay? There's a conscious part and an unconscious part. So let's start with the unconscious part. If you wanna follow along, it'll get it in your muscle memory. This is the back, bottom, inside part of the brain, okay, right at the back of your head. This is the unconscious part of the brain that's responsible for survival. For shorthand in the course, I call this the lizard brain. Lizard brain is an unconscious part of the brain that's responsible for survival. It's the first part to develop in your own body, and it's also the oldest part evolutionarily speaking. So all vertebrate animals have an unconscious part of the brain that's responsible for survival. And it does that in a bunch of different ways, right? So surviving, what it does is it looks out for threat. It takes in sensory data from the world around you and it looks out for threat. It runs your body for you, anything that you're not consciously thinking about. The lizard's just doing it for you. It responds to rhythm, which is cool. And we talk about that a lot in class because it's one of the things that we can do when the lizard is overactive. If the lizard's constantly distracting threat or it's having a trauma response or something like that, one of the things the lizard likes that helps it re-regulate to safety is rhythm. Just very briefly, actually, let's chat about this. Principle 2 is the order of brain development. This is the first part of the brain to develop. It looks out for threat to keep you alive, and it also likes rhythm, and it regulates to rhythm. What was the rhythm that it was first exposed to when it was first developing? Rachel's giving me a heartbeat. Yeah, mom's heartbeat, right? So just as a little side bit, I just love this little piece of information. Rhythm to most people is something that will help regulate us when we feel stressed, right? And this could be as simple as like music or walking or tapping or drumming or dancing or fleshing hides or carving something. There's all kinds of things that could be rhythmical, right? Rhythm, particularly around 60 to 80 BPM, something like that, like the rhythm of a regulated heartbeat, tends to be particularly regulating for folks. You can look up all kinds of like 60 to 80 BPM music playlists on Spotify or something like that. So that's the unconscious part of the brain, okay? Let's move on to the conscious part of the brain. This is the outer part of the brain and the frontal part of the brain. So especially this part right here under your forehead, this is your neocortex or your prefrontal cortex, okay? This is the last part to develop in your own human lifespan. It's very rational and logical, right? We do not share this part of the brain with other animals. This is a very human part of the brain. And so what's it good at? Well, it's not responsible for survival. It's responsible for learning and thinking and making rational, logical decisions and communicating those, right? And for shorthand, I call this the wizard part of the brain, okay? So an important thing to keep in mind, though, is about the order of brain development, right? The wizard and the lizard are both your friends. The brain's a friend, and it's trying to help you. They don't speak the same language, though, right? And so you can have the lizard part of your brain having some kind of threat response, even though the wizard part of your brain knows rationally that this is not actually a threat, right? I feel quite threatened when I'm rock climbing and I'm up at a height, even though I know rationally that I'm roped up, right? So I like to break that down for folks sometimes. Let's go back to the lizard for a moment, though, okay? Because one of the things a lizard does is it keeps you alive. One of the ways it keeps you alive is by running your body for you. This is called your ANS, or your autonomic nervous system. Essentially, anything that you don't consciously think about doing, the lizard does it for you. Okay, this is the ANS. So all kinds of things like your digestive system is a lizard function, your heartbeat, your endocrine system, what hormones, chemicals you have floating around in your body, your breathing, all that kind of stuff, right? Now, here's the way the lizard operates your body, right? The way the lizard operates your autonomic nervous system, or all those different functions, is it operates it on a switch. And what I don't mean, by the way, is I don't mean the lizard switches off, because what would happen if the lizard switched off? You'd die, right? It's not a good thing. Okay, the lizard doesn't switch off. This is a state switch in terms of how is the lizard operating your body, okay? And the position of the switch depends on the other thing of the lizard is that it looks out for threat. If the lizard does not detect threat, then the switch is in the rest position. Rest and digest, or the parasympathetic nervous system, right? My muscles are relaxed, my heartbeat is relaxed, my endocrine system is low, all that kind of stuff. Digestion is a good time for digestion when I'm relaxed, right? Okay, if the switch starts to flip, this is a little bit like the brake pedal in your car, right? But you don't just need a brake pedal, you also need a gas pedal, so you can just have activity in your nervous system or activity in your car. Now, that's a kind of stress, right? Could be positive stress. Could be you driving to the grocery store. Could be even more gas pedal activity in your nervous system. Could be a threat response. Could be fight, flight, or freeze, right? But for whatever reason, if your nervous system is going to activate, the switch is going to flip, and now you're in action mode or fight, flight, freeze mode, depending on what level this is, right? But in general, what that's going to mean, gas pedal activity means you get endocrine system going up, you get cortisol, you get adrenaline in your blood system, you get blood glucose, your heart beats faster. What happens to digestion if my lizard is getting more active or more stressed? Digestion gets downregulated, right? Because my lizard takes energy away from my digestive system to put it towards either action or survival. But either way, other parts of my body are gearing up and my digestion shuts down. Now, in the class, we brainstorm all kinds of ways that you might see this, right? Even if it's just, you're not fight, flight, freeze per se, but maybe you're like out playing sports, or you're out paddling something hard, or you're out having a hard conversation with someone, you're public speaking, right? Your digestive system often gets downregulated. And your prefrontal cortex might get a little bit downregulated as well, right? So your body can put more energy into action. Maybe that means you get a stomach ache. Maybe that means you get constipated. Maybe it means you get the nervous poops. But either way, you're going to see some kind of digestive disruption as your nervous system gets more active, right? Anyway, this is a lot of stuff that we spend a lot more time talking about. Are you ready for your quiz? No, there's no quiz. What this boils down to, right, is that the wizard and the lizard are both parts of your brain that are your friend. You need a gas pedal and you need a brake pedal in your car to have a functioning car, right? And you need a gas pedal and you need a brake pedal in your nervous system to have a functioning nervous system just in your day-to-day life, right? And it doesn't get you into trouble to press on the gas pedal. Your nervous system is made to press on the gas pedal, and your nervous system is made not just for rest and digest when you're home watching Netflix. That's a good state to be in. But your nervous system is also made to go out and run down the street and play sports and talk to people and engage in difficult things. And your nervous system can handle adversity. And your nervous system can handle even potential trauma exposure. Your nervous system can handle anxiety, right? It's not stepping on the gas that gets you into trouble in your car. And it's not stepping on the gas that gets you into trouble in your nervous system. What gets you into trouble in your nervous system is if at the end of the day, when your car's back in your driveway, you can't turn it off. You can't get back to that brake pedal mode at the end of the day, right? And that's what gets you into trouble in your nervous system. Not just going into lizard brain or not just going into sympathetic nervous system mode, but when you can't come out of it, right? And so that's where we're looking in the course at not overprotecting people, but having a balance between that rational mind support and the emotional mind support. So in the course, we break this down into all kinds of different ideas for interventions, and we talk about it's really important that you do these things at the right time, right? If somebody is actively anxious, actively angry, actively in a trauma response, it is not the right time to get into problem solving, interrogating, or offering advice, right? The part of their brain that can take that in and can process information is just not the part that's dominant right now. And so we talk about, this is a good time for emotional mind support, right? Building relationship, active listening, breathing, mindfulness, distraction, movement, rhythm, tapping, all kinds of different interventions we talk about in the course. And then, where appropriate, where we have more information about somebody, where we have a sense that yes, this person wants our help and they're regulated, okay, now is a really good time to bring in the rational mind. And this is where we might offer information. We call this psychoeducation. Hey, did you know your brain's your friend and it's trying to help you? Can I offer you some ideas about what might be happening here for you neurologically, right? We talk about thought challenging. Okay, you're having this really obsessive, like racing, anxious thought that something is going to happen, or the rope is going to break or something like that. Is that thought actually true now? Right? Maybe we don't just want to empathize with the thought and just want to empathize with the anxiety, but maybe we actually want to look critically at that thought and think, is that true? Is it helpful to me to think that over and over again? What else? How can I challenge that thought if it's not true and it's not helpful to me? I want to challenge it now. That's a rational strategy, right? Might we want to challenge behavior? So not just overprotect people from anxiety, but when is it appropriate? Because it's not always appropriate. But when is it appropriate to encourage people to put themselves in situations that they are going to feel a bit anxious in? And then how do we manage navigating them through that with a baby step kind of perspective? That's called behavior challenging. This, by the way, for those of you who are familiar with cognitive behavior therapy, this part of the course, the rational mind part of the course, is based on cognitive behavior therapy. And then finally, how do we bring everything together in a written field support plan? So that's actually great. I'm a little bit behind here what I wanted to do, but how do we put a field support plan together for someone who's having a hard time, and how could this be helpful to them in the field? So before I go on, in the chat, there is a blank field support plan document. This is a document available on our resources page. I'm working right now on expanding it to be more specialized in different areas. We have a few different iterations of this, but this is our basic one, okay? And here's how you might put this together for someone. Field support plans are pretty simple. There's lots of different templates available. There's nothing magical about our template, but our template is based on everything we talk about in the course. I think it's quite helpful. I think it's quite balanced. You can make a field support plan for yourself before you go into the field, and I've had a number of guides, particularly your tree planters as well, take this course and make a field support plan for themselves because they know they feel anxious about something, or they know they have, interpersonal challenges with this person, or they have a trauma trigger or whatever, and so they make themselves a field support plan before their season starts. I've made myself one as well. It does help to have something written. And if you were working with someone at creating this, then it would be good for you if you're in a guiding role or something, then you would keep a copy of this as just part of your overall paperwork. But we talk a lot about that in the course. Let me just show you what's on it, okay? This fairly basic document. Just self-awareness. It starts with self-awareness because it's really helpful for people to have a relationship with their own body, and they can catch those little individual cues that tell you your nervous system's just starting to feel distress, right? I'm not quite in full panic yet. I'm not quite in full blowout anger yet. I'm just starting to feel stressed. And that's such a helpful piece of self-awareness for people to have. My personal little cue that I would write down here for this early on partial stress is that when I just start to get stressed or annoyed with somebody, I stop making eye contact with them, right? So I'm guiding with someone, maybe I have a co-guide, and I'm like, oh, I really wish that person hadn't packed that boat like that, right? And I'll still talk to them, I'll still guide with them, but I'll notice that I'm not making eye contact with them. Yeah, great, why don't you go and get the charts together? That'd be great, I'll go over here, right? So I wasn't aware of that personally for myself for a while, but that was one of my early cues of starting to get into a lizard brain mode, for what you might call it that. And that's been very helpful just to have that sense of, oh, I'm not making eye contact with this person. I think that's because I'm feeling annoyed. Okay, now what do I want to do with that feeling, right? So that's bringing in the empathy and the self-awareness, and then the rational mind of what do I want to do with this feeling? So it just starts with some awareness. We start with some self-reflection about when and where am I likely to feel this kind of stress. That doesn't necessarily mean I'm going to avoid that situation, because that might be overprotecting. It might mean that I push myself in that direction, but I might do it more intentionally, right? So just some awareness. Then I think about, what are my favorite lizard brain strategies? Simple little things I can do to help my nervous system regulate in that moment. Breathing, cognitive stuff, mindfulness, tapping, whatever, rhythm. And what are my favorite wizard brain rational strategies? And there's a reason why on this field support plan I have these side by side, because in an ideal world it's great to have these balanced, right? Your emotional strategies and your rational strategies. What's my self-care plan for as I'm going through the season or the course or whatever? These are just going back to the basics, right? How am I taking care of my physical body? Are there social boundaries that it's going to be helpful to me every day to be aware of? Whatever. And then finally, what are my resources? And I always like to encourage folks to include professional resources like 988 or 310-6789 or whatever your local resource is. And then also there's a little reminder down here to include other resources, social resources, family, clergy, community, sports teams, local church group, men's shed, whatever it is. Because we always like to come back to the idea that connection is a correction. and encouraging people to have good, strong relationships with their community and people around them going forward. I mean, so often we're encountering people in a first aid context for a short-term time, right? And it can be so helpful for them to just have those reminders or have those other ideas for resources, so places they can reach out, because connection is the correction. And we know that having positive, healthy relationships around us is protective for our mental health. So I always like to include that on a field support plan as well. So in the course, we talk about all kinds of different field support plans. There's some that I said, that are more specialized for folks going through different things, but that's our general one. And that's a free resource I like to make available. And we also have little mini field support plan stickers. This is a project I came up with last year. And this is like, hey, yeah, it's great to have this piece of paper that I might put in my backpack lid or in my chart case or something like that. But what if I had a sticker that I could put on my helmet or my water bottle or my planting shovel or something like that? And it's just a little reminder. Now, I'll tell you my one little anecdote about this. I was beta testing this sticker when we developed it about a summer and a half ago. And so I, wrote down on it, what are different things that I can do when I feel stressed and overwhelmed and all this kind of stuff. And I was like, I'll see if it smudges. I'll test it. I'll see if the field support plan sticker smudges. So I had it on my phone for a couple of months. A couple of months later, purely by fluke, I ended up in the ER, right? I'm fine now, but it was a pretty scary day. I ended up in the ER. All I had with me was my phone. And when I'd ended up in the ER, it was like part of my brain melted, right? Which it kind of does, because when you're in that like survival situation and something's happening, you feel like you're gonna die, your prefrontal cortex just goes offline, right? And you're in lizard brain mode. So that's what the mode that I was in. And I found myself in the ER, not being able to think clearly, not quite knowing what was going to happen. All I had with me was my phone, and I was like, I have a field support plan. Okay, what does this say? Anxieties that I struggle with, how this shows up in my body. Yep, definitely feeling that right now. Okay, what are some lizard brain strategies? Yeah, I can do 5, 4, 3, 2, 1. I'm going to encourage myself to do some square breathing. I'm going to do a little mindfulness thing with myself. I'm going to say a prayer. Okay, and what are some rational strategies? What do I want to remind myself of? What's my self-talk telling me right now? Is that helpful? What's my self-care? What little bit of self-care could I do here in the ER? Who are my resources? Who are my social supports? Who can I contact right now? And I went back and forth through this little mini field support plan for a couple of hours while I was in the ER. Probably spent more time on this side of my phone than this side. So I will say from experience, I thought I was beta testing this. When I actually was in a lizard brain situation, or when I was in a potentially traumatic incident situation, right? This was way more helpful than I thought it would be. So I encourage folks to try this out, even if it's something you're like, yeah, I'm mostly fairly stable or whatever. This still could be something that you might be modeling for someone else, or you might be able to actually use it in a critical incident. So we have these little mini ones available as well on the website. I'm going to pause for questions. We are a couple minutes over time, but I'd like to invite us to stay until 6:10. That's how long I'm going to stay for questions, and right before we leave, I'll do a little prize draw for anyone who is still here. So we got 7 minutes for me to take any questions. Thanks for sticking with me, folks. That's a lot of info, and hopefully it's interesting and helpful. But yeah, what's coming up? Maybe I'll just pause for a moment and just ask who you are, because I don't actually know fully who everyone is. So if you're here, please drop in the chat for me who you are or where you work with. I know Mark's with Search and Rescue on Solid Spring. That's fantastic. That's my old stomping grounds. Yeah, Erin, I'm going to post these recordings up on our website, and I'll send that out as well to the mailing list. But yeah, if folks want to let me know just who you work with, that'd be even a good place to start. You can either unmute or you can pop it in the chat. And Erin Rush, I know your name from somewhere too, Erin, and I am slipping my mind where. Aaron says, I'm in Kentucky, outdoor educator and guide, and work for a risk management training and consulting company. Neat. That's pretty cool. I don't know if we've had anyone from Kentucky come through. We have a lot of folks from like Vermont, New Hampshire recently. But you might be my first Kentuckian. Maybe I'm thinking of a different Aaron. I don't know. I thought we'd encountered each other before. John Hissink says, I work for Project Canoe, a canoe tripping program based out of Toronto. Very neat. I did a master's at the University of Toronto, but I didn't get to spend much time like in Algonquin or anything. That's still on my bucket list. Rachel, who I know from Sudbury, Ontario, teacher and volunteer at Naturally Superior Adventures. That's right. Yeah, we did a little program with NSA a year or two ago now. Yeah. Nice to see you again. Jazz says, I work in Ontario for an organization that focuses on reptile and amphibian conservation, involves fieldwork and education. It's not scales, is it? Jazz? Yes. Oh, very cool. We had a student come all the way through the program from Scales a couple of years ago, or maybe it was just a year ago. Nikki says, thank you, Daye. I'm in Newfoundland. I worked in wilderness therapy and guiding and now work for a provincial health authority in Avalanche, Canada. Awesome. Yeah. Jake says, thanks, Daye. This has been a fantastic review. Oh, that's right. Yes. Jake, I thought you looked familiar. Did the basic course back in 2023. Mountain biking. Yeah, my brother-in-law did a lot of mountain bike education in Squamish, but I think you and I chatted at that point and you didn't know each other. The mountain bike community is actually pretty big in Squamish. Yeah. Now run tours in Australia, New Zealand, and Scotland. Amazing. Yeah. Very cool. Other things I'm interested in from folks, not necessarily right now, but just in general, is ideas for guest speaking lectures or webinars, because most of what we do is run the programs, and then by request, I should mention also, so by request we do like, lectures on XY topic or a presentation or whatever, that kind of thing for different organizations. And I should mention also the 16-hour program that we ran through, that's like the public-facing 16-hour curriculum. I also have a 16-hour slightly modified curriculum that is more modified specialty for first responders and frontline workers. And so, for instance, if we're running a 16-hour program with RCMSAR, Search and Rescue Group, or wildland firefighters, or that kind of thing, mostly what it is it's the same 16-hour curriculum, but I switch out, for instance, the focus on anxiety with more of a focus on psychological trauma. We talk a little bit more about grief and loss. We talk about trauma prevention. And we take out a little bit of the curriculum that is more focused on like paperwork or maybe long-term group dynamics or that kind of thing that might be more relevant to an adventure guiding model, if that makes sense. So we do have a slightly specialized curriculum for SAR. Okay, well, it's 6:08, and if folks have no more additional questions, let's do a little prize draw. I'm very grateful for all of you for taking the time to be with me tonight. So here's my invitation. We have a store that after a website crash in the fall, I've just gotten back online. So we do have a store. We have a bunch of stickers up on the store. We have this great Feelings Wheel sticker that I love. It's very colorful. Actually, I have one right here on my water bottle. We also have other stickers on our store. There's a thought challenging sticker. There's an ABC sticker, which we went over tonight. There's a little 5, 4, 3, 2, 1 sticker. There's other kinds of things. So you can pick any sticker that we have on our store if I draw your name. Now, how many people do we have here? We have 13 people here, including myself. So I'm going to do a random number generator between 1 and 12. And then we're going to see what we have. I'll share my screen so you can see the random number generator. Okay, can you all see the screen? Okay, we're gonna press generate. It's between 1 and 12. 1, 2, 3, go. Number 12. Okay, and who's number 12 tonight? It's Vanessa. Amazing. Okay, thanks so much for being here, folks. Thanks, Vanessa. So Vanessa, if you would just want to stay for a moment and make sure that I have your mailing address and your sticker selection, or you're welcome to email it to me. If you have any other questions, folks, please email me. I love hearing from folks. Hopefully we'll see you. We have a bunch more webinars coming up. Next week is boundaries workshop. That's going to be very experiential. That'll be a fun one. And then there's lots of other topics as well. So feel free to come to all of them. Take care. Nice to see you, Rachel.
Thank you.